Hello everyone, I am Dr. Chinnababu Sunkavalli. Today we are going to talk about the recent developments in chemotherapy. A lot has been achieved in the last couple of decades with respect to the chemotherapy, and the practice of chemotherapy today is called as precision oncology or the precision medicine due to the development of target therapies, especially in cancer. So most of the times there are specific drugs called as tyrosine kinase inhibitors, which are tumors are tested for the genetic mutation and any changes that they have, which are called as mutation, and based on that you have specific drugs available which are called as the targeted therapies. So basically the basis of targeted therapy in general is to look at the proteins and whatever the changes, mutation has caused these proteins, and then block them, and treating the cancer through this target therapy is much more in practice these days. So I would say that this form of cancer treatment is very commonly seen in lung cancer, especially the targeted therapy. So many newer drugs have come into practice, and the way we have treating lung cancer has changed because of the next gen sequencing and targeted therapy options and the new drugs that are available. So similarly, there is another kind of a treatment called immunotherapy, wherein you enhance the immunity of the body, which can attack the cancer cells and kill them. So that is helps with the regression of the cancer as well, called as immunotherapy. So there are limited indications for immunotherapy and some scenarios wherein these drugs are used, but in some patients the treatment response is extremely good. So one just example that I want to share with you is, recently we have all read in the news that there is 100% response rate for colorectal cancers, and this is the drug which has caused the response in these patients. So, but however, the mutation is seen only in 5% of the patients. So not every colorectal patient is responsive for this drug. So the other form of immunotherapy that you can think of is called as altered blood cells therapy, which is nothing but CAR T cell therapy, where however it is not very widely available today and not widely used, but in the future you will be having a CAR T cell therapies also coming up, so that they will fight against the tumor in their body. So immunotherapy, targeted therapy is the buzzwords, the newer trends of developments in chemotherapy. Thank you so much for watching this video.